do me in the middle so that I
Hi.
can info.
Welcome to Healthcare. It's Friday afternoon. We are coming back to H233, our pharmacy benefit manager bill. We have legislative counsel with us through our latest draft.
Great. Good afternoon, Jen Kirby, Legislative Counsel. So we are looking at draft 3.3, and I will walk you through the changes from your previous draft, which was 2.3. So I think the first change doesn't happen until page 10. And the first change here is, this is about how much the pharmacy benefit manager would require a covered person purchasing a prescription covered drug to pay, and it's not greater than the lesser of, and under current law, we have the cost sharing amount under their plan, current law, and the underlying bill, maximum allowable cost for the drug or the cash price. There had been a proposal for a while to add the current national average drug acquisition, that's the NADAC, cost plus a reasonable professional dispensing fee. And after committee discussion yesterday, I believe the idea was to take that out. So it is struck in this draft and would go back to just A, B, and C, which are what is already in current law. And then I've also struck the language on the pass-through of the rebates. That was part of the conversation yesterday. It had been proposed by the healthcare advocate, and I think even that office was saying, maybe this was just a concept for now. So this strikes all the language saying that the plan must determine at least annually how much rebate the plan got or its PBM got in connection with dispensing prescription drugs to each person and pass that amount back to the person with any additional amount going through to reduce premiums. And then defining what we mean by the covered person's net out-of-pocket cost. So all of that goes away. And I do remember talking to you about 2 went out, but now 3 becomes 2. So that's where 3 becomes 2 here about the copay accumulator. So that stays in. The references are just changed to 2. Keep going. So next, right, we are in, this is the DFR enforcement language, and I understand DFR had expressed some concerns about the Office of the Healthcare Advocate receiving materials and whether they would be able to maintain the confidentiality of those. So I put in basically the same language for what happens with the Office of the Healthcare Advocate getting the information as we have up above for DFR, except we're not talking about the Public Records Act. They're not a public agency, and I think my mind, not a quasi-public agency. They're clearly a private entity, not subject to the Public Records Act, but in both cases, the information would not be subject to subpoena and not subject to discovery or admissible in evidence in any private civil action. Mike, I am on page 13. I had sent this to DFR, I have not heard back.
So allowing the healthcare advocate get this information still in there.
Yes, allowing the healthcare advocate to get the language, but it's some additional protection on what who can try to access the information through the advocate's office.
Yep.
All right. Next, we have some provisions relating to DFR's charging bill back or charging its reasonable expenses in administering the PBM chapter to the PBMs. I think you heard yesterday from Deputy Commissioner Brown that DFR thought the language about allocating the expenses in proportion to the covered lives didn't make sense to them in this context because there may be some PBMs who require a lot more work from the department to regulate than others. And so they wanted to be able to do it on a more direct bill back basis. So that language comes out. And then in existing subsection B, in looking at this with Emily after the committee yesterday, I realized the rest of it says DFR shall not charge as expenses to the PBR contracting with DVA if DVA notifies DFR of the conditions contained in its contract with the PBM. Couple of confusing things here and potential problems. And this didn't seem necessary anymore because we've already carved Medicaid out of the whole chapter. So in order not to have unintended consequences like exempting PBM who may also do business with people who are not DIVA, and allowing them to have a free pass on the bill back, we would just take this out. All right. I think that is it for the PBM chapter. I know there's at least one other piece that I put in here this morning. Keep going here. We're in section 3, retail pharmacies, filling of prescriptions. And in putting together the section by section, sometimes it's a good way for me to really drill into what all the language says. Again, I realized that in that, you recall in the copay accumulator, we put in language saying the plan doesn't have to count a third party's payments on behalf of the patient if there was a generic available and it wasn't used, and there wasn't a good reason it wasn't used. We put that in, I think yesterday. I did not put similar language in 8 VSA 4089, which is the insurance coverage piece. So I put that same kind of language in the provisions of subdivision Romanet 1 of the subdivision F relating to third-party payment, et cetera, made on behalf of a covered person shall only apply to a drug for which there's no generic or interchangeable biologic, or there is, but the covered person has obtained access through prior authorization, step therapy, or the PBMs or plans, exceptions, and appeals process. It's the same language. It's phrased a little bit differently in the lead-in. So there's a couple of grammatical changes to reflect that, but otherwise it's the same thing. Otherwise, there's a disconnect between the two. And then finally, I think there were some other changes at the end. No, I guess there were not changes at the end. Just the fiscal year. Yes, thank you. I had inadvertently put us in fiscal year 2024 instead of 25. And and I didn't highlight it here, but should have highlighted it. But it had said Insurance Regulation Fund, and no one helped me track down the official name is the Insurance Regulatory and Supervision Fund. So yeah, it says that. This does not make any changes to the wholesaler language, which I know was a topic of discussion. So I wanted to just flag that.
We're going to go to that right now.
So here.
First, though, any questions on what Jen just went over?
Only one very quick question. So is it DFR that's in charge of the Insurance Regulatory and Supervision Fund? That's who disperses money. But that doesn't go through Commerce or any other committee or anything? It doesn't go through.
So this will go across. This will go across the hall and downstairs. It's still an appropriation, but basically the idea here is to have DFR use its existing funding source while we're getting these positions stood up and licensing fees starting to come in.
No, I mean, once it's all passed, then it's DFR that has control of that fund and disperses.
Well, it has to be appropriated. So
it does go through.
So that's why we're appropriating it. But
Okay.
they're the ones who have generated it. They are very well aware of what's in it. But they can't access funds unless they've been appropriated by the General Assembly. That's a
Got it.
constitutional provision.
Thank you.
Any other questions?
I guess you gotta help me out on this one. At the end, it's, for the pharmacy benefit regulations, following permanent positions are created. Are these new body people, or are these positions like exempt enforcement attorney? Do they have attorneys now?
They don't have this attorney position. So they have X number of attorney positions. They have 12 attorney. I have no idea how many attorney positions.
Okay.
They have 12 attorney positions. We're adding a 13th. We have to create positions in statute in order for them to be able to create them in the executive branch or create them in legislation instead. So yes, we are creating 3 new positions. We're specifying a couple things you typically specify. Are they temporary or permanent? We're saying permanent. Are they exempt from the state classification system, the union, all of that, or are they part of it? And so the attorney positions are typically exempt. Most others, except the highest ranking and political appointees, are usually classified.
We are, remember, charging licensing fees, so some of that will be covered.
And these will be employees of the Department of Financial Regulation.
Yes.
So may I just, on my head,
So, yeah.
I was looking.
Yeah, go ahead.
Kenji.
I'm just clarifying my brain. So back to the 405.
Okay.
So what happens is that the
Put
appropriation.
this up. I've been going through this all like you're watching me. Sorry about that.
That's why I'm a little behind. So what we're asking appropriations is when they look at this to use that fund. Is that what we're doing?
Yes, you were telling them, we're not asking for this to come out of the general fund. We're asking for this to come out of the Insurance Regulatory and Supervision Fund. So part of Nolan's fiscal note, we'll talk about that fund, perhaps what the balance is, or what they're anticipating to come in this year. So it's just a different type of fiscal note. Just like when we do global commitment stuff, we're looking at some state, some federal. In this case, it's state, but it's a state special fund as opposed to the state general fund.
And they may say sure, or they may say, oh, no, we think it should be elsewhere. That could happen.
And that happens across.
That's the whole investors.
And that's-
Yes.
Okay. Yeah.
Okay.
You're putting your best effort
We think it's a
here.
great idea, but
All right. So the last thing I had on my list that we needed to talk about was section 4, which is the wholesale drug distributor program working group. So we've heard from several parties on this. It's being asked for by, I forget the organization's name.
Retail druggists, is it Vermont?
Vermont Pharmacists Association.
Vermont Pharmacists Association. However, we have heard from DIVA that they believe, and they sent more testimony that has been posted, that they believe this has already been done. We did it in 2018, and they would need additional resources to do any type of working group. We also got testimony yesterday that is on the website, and I sent to everyone, from the Healthcare Distribution Alliance, which is it's the trade association for the nation's wholesale distributors. They are asking that this be struck as well. So that is our last piece to decide.
So all of section 4?
All of section 4. If we don't strike it, we need to come up with funding for it. Melanie?
This is the section that with the report that has been done when they put the request out for information and heard nothing back.
Yes.
My question is, and I think it was one of the things you emailed this morning or last night, that was a concern. And do you think that would still be the practice now, in the current world, that no one would respond?
I think there's a different opinion on that. I think the Vermont Pharmacy Association would say that it's a different time and someone would, but we're hearing from the Wholesale Distributor Association that that's not the case. So
There's nothing
us
to
to make the policy decision. Oh, sorry.
There's nothing that we can do to mandate them to give that information. So that's like,
No,
right, so
no, we can't make anyone
Right.
do anything.
Yeah.
So
we could send it out and have nothing come back.
again,
There's no-
and we would need funding for it.
Thanks for the clarification. Just making sure.
Murray?
Thank you. I think because this is a healthcare system reform issue, that it unfortunately does make sense at this point to strike it. And I would encourage those interested, including stakeholders, to keep looking at this as a path forward, as one of the paths forward towards a more universal system, where we also decouple the so-called middlemen from the drug distribution process. So I think this topic deserves its own separate bill.
Thanks, Murray. All right.
That means we should strike it. What you said.
Yeah. Is that general agreement that we strike it?
Especially if we go to all that work and do that money and they still don't send anything.
Right.
Seems,
Okay.
yeah, agree.
All right, so we're gonna ask Jen to strike it.
Fine, I had another version where I also struck it just in case. Yeah, just want to be prepared. I know. I have a 3.3 and a 4.3 because I've been making all the same changes. Which one?
So are you all good without seeing that version? She can just make sure.
version is only with it struck.
Yes, I can send it to Claire to post
Yeah,
if you want.
that'd be great. Send it to Claire to post. All right, so, conversation before we.
How many
bring this
pages
to
is the
a
bill?
Vote.
Well, it's about to be a little shorter. I don't know, I don't have a version where it's actually out yet.
8 or 29, 30.
Around 30.
I'm gonna start reading it again one last time right now so that we can vote on it soon.
That would be great.
All right.
So Jen also did a great section by section. Thank you, Art, for asking that.
Update if you vote something out to reflect what actually.
Where was that?
It's on there. So section by section is great. And I think I'm just gonna summarize this bill by basically saying we're trying to license pharmacy benefit managers to provide more transparency and allow DFR to do more regulation on this middleman or woman that we've middle people that we've heard so much about. We're putting in reporting for DFR. We are doing the licensure. We are increasing from Act 131, the PBM prohibited practices. And it includes copay accumulator language. We're banning spread pricing, but over time for the insurer that has it in their contract. Just kind of picking out the highlights of the things that were.
Great, Laura, keep going.
Okay.
This is great.
We're basically saying DFR can regulate and license and regulate PBMs in our marketplace. Go ahead.
The bottom line with me with this, and there's so much I don't understand, because I still struggle even with everything everybody's given me, and just, I get that part, that's pretty boilerplate.
Mhm.
Will this bill increase the cost of drugs to the patient? And that worries me, because, and the other thing that worries me is and I'm not saying I'm not going to support the bill, but we heard from the PBM, and one of the things they said was we just instituted, was it Act 131, Larry's bill 2 years ago? We just did that. Maybe we need to let that percolate a little more and see. I just worry we're going to do something here that drives up the cost.
Honestly, I can't answer that question.
Yeah,
But
right.
I can say, I think we took the most controversial pieces out that might have driven up the cost.
Okay.
Because it would have required a lot more cost for implementation of some of the things that we wanted.
Okay.
Licensure, DFR recommended in the Act 131 report that they be allowed to license these entities.
And I don't know who this PCMA is. We all got that.
It's the PBM Trade Association.
Right.
Yeah.
Is that
We all got the thing. You got it sent to you. You sent it out. Pharmaceutical Care Management Association.
yeah, so that's the Pharmacy Benefit Manager Association.
Okay. And I know we're trying, I hate to say it, but make them out to be the boogeyman here. We have to take some of what they say seriously here and consider a little bit.
Yep. And Mari, if you are there, I believe we've heard testimony that in other states where PBM laws like these, and I don't want to talk out of turn, so if I am, tell me I'm wrong, that there's been no increase in premiums because of these types of things.
Correct. There, we had testimony from I can't remember who now. There was the pharma had some testimony that said that there was no increase in premiums, and then another the arthritis, the person from the American Arthritis Association, talking about other states that have implemented the similar proposals that are in this bill. And the proposals in this bill are not the big ones that are controversial, as Lori said. The dispensing fee, which would help save community pharmacies, is no longer in the bill. That was one of the most controversial ones. And then the other points were of controversy were more around how it would work for for example, current insurers in current contracts to try to change their process. So we've come quite a way toward insurers, and we have made some exceptions for PBMs as well. I think one of the best parts of the bill is what it does for people who buy prescription drugs at the counter. It will benefit them. In particular, I'm thinking of how it will the copays will, and I believe the discount is still in there. Maybe I'm wrong about that, but that will help count towards the deductible.
Yes, that's still in there, which you're right, is a direct benefit to Vermonters. Do you have your hands?
Well, I was gonna say something in response to Art in that, what was the act that we did 2 years ago?
131.
31, that's what I'm guessing, so everybody's been
So if
saying.
you think about it, and, you know, I know that right now PBMs have to register, but the work we did 2 years ago will be more enforceable, and
Well, I think the registration's good,
because we'll license
Say
them and
yeah. Oh,
actually be able to.
Right, and I totally believe in that. It's beyond that I goes into
Yeah.
some mirth that I don't,
Yeah.
I think.
Yeah. Yeah, I mean, to me, the key things are the licensure and then the help with the copay accumulator, helping patients.
The one other change, if you're taking the wholesale drug distributor, I'm just gonna put this up, is that I proposed changing the name of the bill, and believe the name of the bill currently is Pharmacy Benefit Management and Medicaid Wholesale Drug Distribution. So I suggested an act relating to licensure and regulation of pharmacy benefit managers.
Thank you. All
Put that out there before.
right, any other comments, thoughts? Questions?
We're down to 29 pages.
Great.
Pieces that came out in the lack of the bold.
You can get it back up if we try.
It's an extra space.
Postpone action till next week.
All right, any other comments, questions? Everyone ready for a vote?
Yes, please.
What version is it?
What version is it, Jen?
4.4. Just taking the 4.3 and making it a clean one without the.
Can I hear a motion?
I move it, I'll move it. Move we adopt
4.3.
4.3.
4.4.
4.4, sorry.
4.4 S 233.
Page 233.
I'm sorry, I'm not in the Senate yet. Yeah.
That's all I'm saying.
All right, any more discussion? All right, Melanie, call the roll.
Where to start? Representative Rebecca,
Yes.
Representative Carpenter, yes. Representative Chena,
Yes.
Representative Portis,
Yes.
Representative Demar,
Yes.
Representative Farley's Rubio,
Yes.
Representative Goldman,
Yes.
Representative Peterson,
Yes,
Representative McVaughn,
Yes.
Representative Black,
Yes.
Representative Oaten.
Yes. Thank you.
11-0-0.
Great. Thank you, everyone. Mari's going to report the bill. So I'm going to rely on Claire to help and Melanie to help us figure out how to do that while Mari is not here. Mari, thank you for joining us and thank you for the great work on the bill.
Thank you.
Thanks, everybody. I appreciate you hanging in there with me for the last few years on this stuff. And Claire, let me know when the next vote is. You can just text me.
There's no more votes today.
Oh, okay.
Yep. No
All
more
right.
votes
Well,
today.
have a great town meeting week, everybody. Take
Thanks,
care.
Mari.
Trip.
So we
Thank
are
you.
not going to do 721 today. I'm still waiting on some information we need. So we'll take that up when we come back from town meeting break.
Great.
So we are done for the day. Thank you for the great work this week and enjoy your